All right, time for the checkup today. The health experts are sounding the alarm regarding the physical impacts of remote work. They say that working from home encourages a more sedentary lifestyle, and it can contribute to a number of things like blood clots, which is serious cardiovascular disease, and diabetes, all major concerns. Remote work arrangements can also make it easier for people to maintain bad habits like smoking, drinking, snacking all the time. However, advocates for remote work say there's also some benefits to employees working from home: job satisfaction, increased work-life balance, and less stress, right? So the mental component seems to be working. Joining me now to talk more about this, Dr. Corey Hebert of the LSU School of Medicine. Okay, so we're weighing some pros and cons health-wise for working at home. What's your medical opinion?
Well, Marty, I mean, with 3 million people dying annually because they have sedentary lifestyle all over the world, and we talk about really dying, we talk about dying inside, not actually physically dying, because the reality is that when you don't get out, you have a sedentary lifestyle. You do not move, you don't exercise, you generally feel better because you don't have to get up in the morning and put on a suit. But the point is that we know that increased blood clots, increased diabetes, increased ability to drink alcohol, increased ability to do drugs, increased ability to kind of wander off and not be focused. All these things are the effect of you working at home. Now, you know, we had people working at home long before it was COVID-19. We know that people worked at home, but it just became so much in the commonplace after COVID-19 that people don't want to go back. But we do know, and this is in defense of people staying home and working, you know that the output of your work product is better if you stay at home. So decrease stress, but bad stuff. What I would suggest is that people stay home and then don't do bad stuff. Make sure you exercise. Yeah. Make sure you don't drink all that alcohol. Make sure you don't just sit and eat bags of Doritos all day. And then that might be the best hybrid.
Right. And if you can, I mean, maybe you get a treadmill and you walk while you work, or you could do a Zoom call outside, right, while you're doing some gardening, sure, perhaps. I mean, who knows?
Absolutely.
You got to get creative. I want to talk to you about malaria. There was a 21-year-old member of the National Guard speaking out now about a malaria diagnosis. His name's Christopher Shingler. And just for folks at home, he was initially misdiagnosed when he sought out some medical treatment in Texas in May. He had a fever, difficulty breathing, eating. He was vomiting. Doctors told him, "You've got a virus." Well, he didn't buy it. Sure. He went back to the doctor and they said, "Oh, actually, your test confirmed you've got malaria." He's one of the locally transmitted malaria cases in the U.S. Mm-hmm. He likely got it when he was stationed at the U.S.-Mexico border. Dr. Hebert, we're hearing more about malaria. Is this a big enough concern? Are we worried that it's going to spread?
I don't want people to start fearing they're going to die of malaria. We have enough people dying from heart disease and all the things that are actually going to cause problems. But people have had some issues with malaria. We've had about 4 or 5 cases over the United States. You get it from the mosquito. It is a parasite. You start getting nausea, vomiting, fever. Then your eyes turn yellow. You get jaundice. And it's easily to be mistaken very easily as a viral infection, probably like a COVID-like infection. And that's what this young man got diagnosed with. So what do? We need to prevent malaria. You can treat malaria. So I don't want people to think that if you get it, you're just going to die. That's not the way this works. There is treatment, but we want to stop getting bitten by mosquitoes and exposing yourself. So we need to use a mosquito repellent when we go outside. When you have your outdoor barbecue tomorrow and it goes into the evening after you've had all that alcohol when you should have been working, we need to make sure that you put up have some candles out there so that you don't get bitten by mosquitoes, because that is basically the only way you can get malaria. But I don't want people to start thinking like it's going to be an outbreak, because I don't see that happening.
Okay, something we're monitoring. There's also thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.